Hello, everyone. Thank you for being here. I'm Senator Tanya Vyhovsky, and I'm really glad that you are here to support initiatives to solve some of the crises within our healthcare system. And I apologize for being a little late. I was over at the pavilion dealing with a different crisis in our current structure and system. So the current system of healthcare is unsustainable. Vermonters cannot afford double-digit cost increases year after year. We can't continue to go on like this. We need to make change, and we need to take action to transform these collapsing systems into systems that meet the needs of the people and are sustainable. In response to the Green Mountain Care Board rightfully naming that Vermonters cannot bear the burden of never-ending cost increases, our largest hospital network chose to cut frontline services like primary care, mental health care, and dialysis in the midst of a crisis in mental health and nationwide declining life expectancy and health outcomes. This is barbaric. Once again, the people who have the least ability to pay more are being asked to do just that, to prop up a system that prioritizes profits over people. Who is constantly asked to sacrifice amidst Vermont's healthcare crisis? So far, it has been patients and healthcare workers who have faced high insurance rates, medical debt, alongside service cuts, closures, and declining outcomes. A bill that I will be putting forward today, or maybe tomorrow, moves our healthcare resources to the front lines of the crisis by eliminating unnecessary spending in the system. When we are in crisis, it seems we always ask those who are barely getting by to sacrifice more. Patients are asked to pay more for less. Frontline care staff are asked to sacrifice living wages or safe staffing levels. This is not okay. At this point in time, when the wealthy are getting wealthier and the working class is falling further and further behind, it's well past time that we turn the tables and demand that those with the means to make sacrifices do so instead. We Vermonters often think that our state is exceptional. Unfortunately, in healthcare, we are indeed exceptional. We are exceptionally expensive. Vermont has the highest cost for employer-based insurance rates of any state in the nation, and out-of-pocket costs have doubled in the last 20 years for many Vermonters. This, partnered with rising costs across our system and 30,000 Vermonters losing Medicaid coverage in 2023, adds to despair, poor health outcomes, bankruptcy, and homelessness. In the United States, the #1 cause of bankruptcy is medical debt. An individual who is diagnosed with cancer is likely to exhaust their entire life savings in less than 2 years. In addition to these individual and community harms, healthcare costs are the largest driver of increases in our education spending and the resulting property tax hikes. This is unacceptable, especially while administrators and executives are comfortably earning some of the top salaries in our state. We have seen an outpouring of nationwide righteous rage at the state of healthcare in the United States, and the status quo cannot continue. We cannot keep asking people to go bankrupt or die to line the pockets of administrators and insurance executives. At this point, the only people who think that the healthcare system is working are those who are profiting from it. To that end, I will be introducing a series of bills meant to move us in a better direction. S1 proposes to move all Vermonters to a Dr. Dinosaur Medicaid-like program of universal coverage in age bands over time. S8 expands our children's Medicaid program to income-eligible Vermonters until they are 26, in line with private coverage under the Affordable Care Act. And I also have bills in drafting to further address medical debt, make copay-free access to life-saving emergency medications like epinephrine, albuterol, and nitroglycerin. But the bill we're here to discuss today, that will be introduced shortly, asks those with the most ability to make change for the public good to do just that. It demands that we stop trying to mitigate our healthcare crisis by bleeding our workers dry and the patients who need critical care that simply cannot pay higher premiums or out-of-pocket costs. It is a response to a recent report that shows our largest health network has skyrocketing administrative costs, not in line with national averages for care staff to administrator ratios, and increases our highest in the nation cost of healthcare without any outcomes to show for it. The 2024 Oliver Wyman report repeatedly referred to high administrative spending at the UVM Health Network as a driver of overall healthcare increase in cost. As the report pointed out, total administrative costs at the UVM Medical Center and Health Network, including staff salaries, significantly exceeded benchmarks from other academic medical centers. In addition to this report showed the ratio of administrators to care staff is 6-to-1, while the national average range is from 12-to-1 or 20-to-1 at best. We have twice the number of administrators as other peer hospitals. The bill I'm introducing would require hospitals to provide information about employee compensation and administrative staffing ratios and direct the Green Mountain Care Board to ensure that the ratio of administrative employees to hospital employees delivering healthcare service directly to patients is aligned with national averages for similar hospitals. It would direct the Green Mountain Care Board to ensure that the compensation for hospital executives and clinical leadership does not equal more than 10 times the hospital's lowest paid employees who deliver healthcare services. I've heard the critique that this bill will not solve the healthcare crisis, and that's true. There is one singular policy solution that would solve the crisis we find ourselves in, and that is single-payer universal health care, a policy that every developed nation but the United States has figured out. The idea of ensuring that people who needed health coverage had the coverage they needed began in 1883 in Germany, and by 1930, virtually every Western and Central European countries had some type of basic universal coverage. And the transition to a true universal single-payer system was realized for the first time in 1972 in Finland, and it is now the law of the land in all but one developed nation, ours. It is the path that most industrialized and developing nations are on, yet the United States remains an outlier, which might be excusable if this meant we had better outcomes, better care, shorter wait times, or lower costs, but none of these things are true. However, the political appetite for universal coverage remains inadequate to move towards doing what we know works, in large part due to the greed of those who benefit from the status quo. Short of single-payer health care, there is no one policy change that will slow the sinking of our current system, and we will have to pick away at the problem from many angles to reduce harm, which is just what this bill does. This is one arrow in the quiver of reducing the harm in our system. It will not solve the entire problem, but it will ease the burden on the Vermonters who are simply tapped, the Vermonters who cannot continue to bear the burden of skyrocketing costs, and the Vermonters who need critical care in their community. Enough is enough. It is well past time that we ask those who are benefiting from the status quo to step up when the status quo is deadly to many of us. I want to next introduce my co-sponsor, is not quite the right word, but there will be a companion bill in the House being led by Representative Esme Cole.
Thank you all, and good afternoon. My name is Esme Cole, and I'm one of the lead bill sponsors for the companion bill on the House side to task the Green Mountain Care Board with moving healthcare resources to the front lines of patient care amidst a deepening healthcare crisis. This will be achieved by three primary measures. One, to cap hospital executive compensation to no more than 10 times that of the lowest paid patient-facing staff. And two, to require that the ratio of hospital administrators to clinical expenses is in line with national averages. Three, to improve transparency by requiring hospital 990s to reflect current budget year salaries so we know the numbers we are working with sooner than 2 years after the fact. And Rep. Cordes will speak more on this piece, having advocated for this reform in the past. A slight adjustment in the House version of the bill will be a change to denote total compensation instead of just salary. I think most of us in the United States are feeling nostalgic for the promise that the harder you work, the more you will be capable of earning. Our Vermont hospital executives work really hard in the context of our nation's privatized, broken healthcare system. However, it would be difficult to convince me that they are working up to 50 times harder than the LNA on the overnight shift during the COVID pandemic. An estimate of the most recent compensation ratio data between our highest and lowest earners. A 1 to 10 maximum salary ratio would bring us closer to a distribution of wealth curve that more justly reflects the contributions of our direct care providers. Importantly, the savings from this check will trickle into the overall cost of healthcare in Vermont, which currently ranks at the highest in the nation. Over the past 5 decades, the top 1% of American earners have nearly doubled their share of national income. Our healthcare system is not immune from the exponential widening of the inequality gap we are seeing nationwide. We have become so complicit in these trends, in fact, that when budgets get tight, the suggested remedy is not a cut at the top, but rather in the programs that affect Vermont's most vulnerable, such as our dialysis clinics or the residential psychiatric unit. This trend will continue to go unchecked if we do not intervene. This bill is just one of many pieces of the puzzle required to improve access to and quality of care while reducing costs. Thank you for your support.
Thank you, Representative Cole, and thank you for being such a wonderful partner on this. Next, we are going to hear from Nicole DeVita, who is the President for Healthcare at AFT Vermont and the Vice President for Technical Professionals with the Vermont Federation of Nurses and Health Professionals.
Thank you. It is no secret that Vermont is in a healthcare crisis. We're all obviously in this room for that very reason. Insurance rates are high and unaffordable to many. Vermonters face medical debt and recently there have been cuts made to essential healthcare and mental health care services. We cannot keep cutting from the most vulnerable or from those providing the services. We heard from the 2024 Oliver Wyman report repeatedly that there is excessive administrative spending at UVMMC. The health network is paying almost $500,000 bonuses to the CEO while cutting patient services from essential healthcare services. This bill would have the Green Mountain Care Board ensure that compensation for hospital executives and clinic leadership does not equal more than 10 times that of the hospital's lowest paid employee, those who are actually delivering healthcare service to our patients. Patients and healthcare workers should not have to bear the burden or the brunt of this crisis. It is well past time that executive and administrative leadership be willing to take part in the pay cuts to do their part in contributing to improving affordability and access to care in Vermont.
Thank you, Nicole. Next, we'll hear from Representative Mari Cordes, who is also a nurse.
Yes, I'm a registered nurse. I'm also a legislator, and I work on the House Health Care Committee. I've been employed at UVM Medical Center for 24 years, currently in a progressive care cardiology unit, a very fast-paced unit. I love my work and the teams that I work with. I'm also a founding member of Vermont Federation of Nurses and Health Professionals Local 5221, the past president and the past VP of AFT Healthcare. And I've had multiple experiences of sitting across the bargaining table from hospital executives and their labor attorney while they told us that while hospital executives deserved high compensation and benefits to make sure that they could recruit qualified leaders, that same reasoning didn't apply to frontline staff. Hospital executive compensation, including bonuses for exceeding revenue expectations, continues to grow by the number of executives and the amount at a rate significantly outpacing wages and benefits of frontline workers. And the access to information that we have about the hospital total compensation, we get 2 years after the fact by law. So the $500,000 bonus that Nicole mentioned, I would say is very likely much higher than that in fiscal year 24, and I do have some information about that. In addition, I believe that there are about 240 upper administrators in UVM Health Network. The consolidation of power in healthcare over the past 2 decades has followed a predictable path, one of profit and control of the market for services and for pharmaceuticals. Even our nonprofit Vermont hospitals, particularly the UVM Health Network. Indeed, there are efficiencies of scale provided by such consolidation, but it also provides the incentive and ability to raise the cost of certain drugs and services, while the focus on financial gain and productivity concerns are causing significant provider burnout. Even now, providers are again being asked to limit how much time they spend with patients. And just a note, we do address this issue in another bill that will be introduced in the House later today, H71, an act relating to healthcare entity transaction oversight and clinical decision-making. UVMMC has continued to produce excessive revenue and charges the highest cost for many services in the region. Our largest commercial insurance provider has been losing money for the past several years because of this. Blue Cross Blue Shield says prices at our local hospitals and healthcare systems are among the highest nationally in nearly every comparative data set. And the degree of these cost increases cannot be attributed to an aging demographic, as Blue Cross Blue Shield points out, because that demographic in Vermont is relatively healthy. We, the people of Vermont, the Green Mountain Care Board, and employees don't have access to current data on executive total compensation, so that includes salaries, bonuses, benefits, and other perks, because hospitals aren't required to share that information newer than 2 years old. Our bill addresses that issue. The Green Mountain Care Board, as a regulatory body, must have real-time data and oversight of the problem of exorbitant executive compensation, and it is only fair that the bargaining unit negotiating staff wages and benefits at the table with the hospital's attorney has the same current information on executive compensation that the hospital does. Vermonters and businesses are hurting from the outrageous costs of healthcare and pharmaceuticals. Hospital leaders and the government must work together to address this crisis, not reactively, as we've recently seen, and unilaterally by cutting access to critical services like dialysis in rural areas. Hospitals making a good faith effort to cut administrative bloat in the middle of a healthcare crisis worsening by the Trump administration as we speak would be appropriate. Instead, they have doubled down on cutting staff and services, and I just heard that there'll be another clinic closing, Berlin Family Practice, I believe. So that's I think the second, maybe the third, when we're having a shortage of primary care providers and access to primary care. So they're going to close another clinic. They've also misled the public about what the Green Mountain Care Board actually asked of them and have not been upfront about excess revenue over expenses. In fiscal year 24, the excess revenue was $240 million, and of that, 138 million was net unrealized gain. They refer to it as non-operating, and that's investment money. So that's still ratepayer money, that's Vermonters' money, being invested in the stock market or elsewhere to bring in more money for them. UVM Health Network had a really good fiscal year 2024, and for that, they provided bonuses for hundreds of administrative positions and provider leaders. Money that could keep the CVMC inpatient psychiatry unit open, clinics, and dialysis units open, and keep critically needed frontline staff in their jobs. And in my work at the hospital, I am noticing that even when there is acute need for patients to have care, the hospital is capping or lowering the census that they'll allow to have on the unit and sending staff home instead. For now, and for these reasons, I'm co-sponsoring this bill as a strong step forward to bring healthcare dollars back to the people and to begin to stabilize Vermont's healthcare crisis.
Thank you, Representative Cordes. Next, we'll hear from Heather Bauman, the Vice President for Healthcare, AFT Vermont, and the President of the UVM Medical Center Support Staff United.
Hi, everyone. It's a pleasure to be here today. It's lovely to stand here with my friends who I see on the floor at the hospital. I'm a phlebotomist, primarily work at the main campus in Burlington, but to see Deb, to see Mari, to see Nicole here gives me heart. These are the frontline workers that I see when I go to work, and I'm proud to stand here representing the 2,400 support staff at UVMMC. These are the low-wage workers that we're talking about today. My colleagues work exceptionally hard. They come to work every day to make sure that our community is safe and healthy. They are living, they're earning closer to a livable wage since we won our contract, but still not quite there. Our colleagues at CVMC are earning pennies. They are not earning a livable wage, and they struggle to find to earn enough to be able to take time to be with their families, let alone to, comfortably check out at the grocery store. But one thing that I know for my colleagues, and I know it's true for my other support staff colleagues across the network, is we cannot afford health care. We cannot afford to access the services that we work so diligently and compassionately to provide every day. We are not asking to get rich. We are asking to get by. We are asking to be able for more equity so that we can afford the services that we provide to the community, and we look forward to the administrators and the executives joining us in this struggle and finding more equity in a system that has lots of room to grow equity.
Thank you. Next, we'll hear from Catherine Becker Van Haste, the State Director at the Office of Senator Bernie Sanders.
Good afternoon. Again, I'm Catherine Becker Van Haste, State Director for Senator Bernie Sanders. It's no secret that Senator Sanders believes that we have a broken and dysfunctional healthcare system. As was mentioned previously, he also shares the belief that the best way to move forward in the United States of America is to join every other developed country in having a single-payer Medicare for all healthcare system. By doing this, we provide every American the opportunity to receive the quality health care they deserve, regardless of their ability to pay. This has been a mission for Senator Sanders for his entire time in Congress, and we continue that fight regardless of changes and headwinds and the difficulty that we face. That doesn't mean that we stop. It doesn't mean that we give up, and it doesn't mean that that is our sole focus. As we push towards a Medicare for all single-payer system, we know that we can improve our current system. We also know that our current system does not exist divinely. It does not exist just because. It exists because it has designed to work the way that it does. We have the system that we have because people designed it that way. And so if we want a different system, we have to change our design. And one of the ways that we can change that design is by looking at how much we are spending on direct patient care and how much we are spending on administrative costs. We know that in every hospital and health system across this country, we have managers who never see a patient, who never touch patient care. They may be arguing with an insurance company over a bill. So now we have executives at an insurance company and we have executives at a healthcare system that are doing absolutely nothing to keep our people healthy, to take care of them when they are sick, or do anything to improve the lives of the patients who they are serving. By looking at executive pay, it is also an opportunity to get to equity for the people who work at the bedside, who take care of patients, who see the sick person who doesn't know how they're going to pay the bill when they leave the hospital. These workers do amazing work, not just in caring for the physical health and well-being of the patient, but also easing their fears and their concerns while they're there, for holding the hand of a family member who doesn't know what the future looks like. We cannot look those workers in the eye and say that their jobs matter less than the person who is moving papers on their desks. We have to acknowledge that there needs to be more equity in the system between our executives and our frontline workers. I have to say that as someone who is an executive by all reasonable accounts in my office. I can't imagine walking into work every day, looking my staff assistants in the eyes who are on the phone day in and day out with Vermonters who are crying with them about the housing crisis, who don't understand how they're going to pay their health care bills, and say that I deserve to make 50 times more than them, 10 times more than them, I make less than 2 times more than them. And it is a priority for Senator Sanders to pay his staff in an equitable manner. We want to see all members of Congress do that. But at the very least, we need to look at our healthcare system and recognize that we need to do better by our patients, by our workers, and really prioritize patient care over administrative costs. So I really want to commend our Vermont legislature for taking on this important fight, for recognizing that we can do better and we must do better by all Vermonters. Thank you.
Thank you.
Thank you. And last but certainly not least, Deb Snell, the president of the Vermont Federation of Nurses and Health Professionals.
Thank you for being here today for this important news that is breaking. And sorry, Mari, I have you beat by a year. I've been here 25 years. I'm also a nurse in the medical intensive care unit for the last 24 years. So when you talk about like the LNAs during COVID and everyone at the bedside, I was there front and center. Didn't really see too many executives walking through the unit then, although Senator Sanders did come and visit and he did walk through. So let's talk about executive pay for a second. So we know that Sonny Eapen received an almost $500,000 bonus. That $500,000, number one, is Vermont patients' money. We can't forget that. This is money from Vermont patients. Giving him that bonus, that would have paid for 3 advanced practice nurses for a year. What is more important? Getting healthcare workers front and center to care for these patients? Working in the ICU, I'm seeing patients coming in sicker, but not only sicker, younger. They're younger because they don't have access to care. They're waiting. My son, who works at the hospital, 6 months before he could get a primary care, even doctor, to get on the books. That's insane. Our own staff at the hospital cannot find a primary care provider. Our own staff, nurses included, have medical debt with their own institution. That's insane. Mark contracts online. I've been there 25 years. You can look up and see how I make good money now because of our union and the work that Mari and the people ahead of me put into our contract negotiations. So we have a livable wage, and we still have medical debt. We still can't afford houses in our state. We still struggle with transportation in our state. The Wyman report was 100% accurate, that those are absolutely the top issues in our state. The Blue Cross Blue Shield report, this blew my mind. Since 2021, the cost of primary care has increased 49%. 49% in Vermont. Where is that money going? It's not going in our pockets. Do our patients, can they afford that? No, they can't afford these high costs. We need to invest in getting primary care in our state. I'm sick of seeing 26 to 34-year-olds in my ICU that if they had been able to see a doctor, or even older, a gentleman coming in having a stroke because his blood pressure was so high that if he had seen a primary care doctor, they would have caught that. He would have been on the right medication. This would not have happened, and that drives up healthcare costs. We need to empower the Green Mountain Care Board. They need our help. They need more resources. This is the only way spending is going to be kept under control in this state. And I can say, and Mari, anyone back me up, I was there before the network. The network has not made anything better. The network has made things worse. We are the dumping ground, and I hate to say that, but from New York and all these other hospitals, they just send everybody to us, but they won't take them back. It was supposed to be, the whole premise of it was to be like a cost-saving measure for like mostly the supply chain. How big has this network grown? It is out of control, and the salaries are out of control. Their staff ratios are out of control. I wish I had some kind of ratios in our ICU some days. But the work being done by these legislators, thank you from the bottom of my heart. It means the world that these issues are finally being tackled, and they need to be, because our patients can't wait any longer. Thank you.
Thank you, Deb, and thank you to all of our healthcare delivering staff who are out there every day doing the best they can with resources short of what they need to make sure that Vermonters are as healthy and as cared for as possible. We all have, I have medical debt. I have waited 9 months for an acute neurology exam post-concussion. Our system is not working. It is not keeping people healthy, and it is not affordable for Vermonters. This bill is one small step in creating equity and righting this sinking ship. It is not the sole solution, and I will look to the people who are doing the work and my fellow legislators and every Vermonter to help us navigate a path forward until we have the political will for single-payer universal health care. Thank you so much, and I am happy to take questions.
What's the lowest salary at the hospital?
So at UVM, it's $20.60 an hour, but UVM is a unionized hospital, and we know that unionized shops pay higher wages than non-unionized hospitals. Not every hospital in Vermont is unionized. The average, or the sort of average starting wage for an LNA at a Vermont hospital is $15 an hour. And that would equate to about $312,000 if we were to pay 10 times more than that. And there are currently over 100 Vermont hospital executives and clinical leaders making above that.
Do we have any idea, based on, I know this is probably a tough number crunch, but based on the salary data we have, how much money that would save if hospitals did adhere to this?
I don't have that handy, but I'm certainly, if this bill moves forward, we would ask the Joint Fiscal Office to do an analysis of that. Does someone else?
That was my answer, too.
Okay.
I mean, that's a ton of money. I mean, if you look at Sunny's compensation, it would be like $1 million.
And that $500,000 bonus, again, I don't think is current. I think if we 2 years ago. 2 years ago. So if we looked at fiscal year 24, I believe the bonuses to I believe is around 240 individuals would be much higher. So certainly enough to pay for continuing badly needed dialysis clinics, to stop the closure and keep the primary care practices that we so desperately need, and keep the inpatient psych unit going. What we really need hospitals and UVM Health Network to come to the table in a good faith effort instead of behaving reactively and unilaterally because they can.
And we're in the middle of our contract, but if, Sunny wanted to keep his wages where they are, we'd be open to raising ours. Yeah. Just saying, putting it on the table.
Or paying off workers' medical debt.
With the state of how things are right now, we can't continue to come to the table with the idea that this is the only way. This way is not working. We have to look at another way.
Did you run this idea by anyone on the Vermont Care Board? Is this something you're asking for, more ability?
I ran the sort of loose idea by I don't actually know if it's a current member of the Green Mountain Care Board, but I have sort of had some very abstract conversations about this idea, but I have not explicitly handed this bill to anyone on the Green Mountain Care Board.
And I have handed the House version with the lead sponsor's permission, and am anticipating further conversation with the Green Mountain Care Board about this bill.
There are no other questions. I want to thank everyone.